In today's video, we're going to be talking about how often do you use TMS therapy. With me today, I have Dr. Kevin Murphy. Doc, can you tell us a little bit about who you are?
Thanks, Kyle. Yes, I'm an oncologist by training, specializing in pediatric and adult brain tumors with a process called radiosurgery. And the last 10 years, I've spent time working on a personalized approach to transcranial magnetic stimulation.
So, doctor, how often does one get TMS?
Well, the standard by most insurance providers is to provide 30 to 60 treatments.
Okay.
It's one time per day. So you're talking, 6, 8 weeks, 10 weeks of treatment is kind of a typical approval process. In our case, with personalizing the TMS, it depends on the patient's existing brain state. So if I could have a pro athlete that wants to perform better and their brain's largely in coherence, it might just take 2 weeks for me to treat that patient. 10, 12 treatments might be enough. In my autism kids or my cerebral palsy kids or my brain tumor kids, it might be months of therapy. And then we give those patients a tune-up, usually at 3 and 6 months after their course of treatment. So there's one big shift to a new position, and then we see those patients back at 3, 6, 9 months, and we add a little bit of dose in for a week or two to try and boost the effect.
Okay.
So
is this a therapy that you're doing 7 days a week, 5 days a week? What are we talking here?
So typically 5 days a week, 6 days a week. I treat patients twice a day in some cases.
Really?
3 hours apart. We do that for some of our head trauma patients and other patients that are hard to overstimulate. Depends on their phenotype, but there's a subset of patients I really prefer twice a day therapy with.
Okay, like who?
Autism kids, brain injury patients, TBIs, traumatic brain injury.
Yeah.
Where you can't overstimulate those systems really.
Okay.
They don't hold a charge with the therapy, and that you can afford then to get in more dose per day
faster.
And I see better results in those patients. And it's more than just linear, which means it's not just additive. It's not just twice as fast.
Okay.
It appears to be more than twice as fast. In terms of, if you give twice a day dose for a subset of patients.
Okay.
Yeah.
Hey guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.